Good morning, and thank you for being here. I'm Dr. Nina Ahuja, President-elect of the Canadian Ophthalmological Society. Joining me here today is Elizabeth Fowler, our CEO. We are here representing the Canadian Ophthalmological Society, supported by national physician organizations, including the College of Family Physicians of Canada, which has provided a formal statement. Bonjour. Merci d'être ici aujourd'hui. Il s'agit d'un enjeu important pour la sécurité des patients et pour la qualité des soins au Canada. Today we are addressing an issue that is important to the health of Canadians: how education, training, and standards translate into safe patient care across the country. This is especially timely as proposals for scope expansion are actively being reviewed, including proposals that would allow non-physicians expanded authority to perform procedures, order diagnostic tests, and independently manage disease. As these proposals are being considered, it is essential that they include formal review by the appropriate physician specialists, ensuring decisions are guided by the highest level of medical expertise, evidence, and patient safety standards. Il s'agit de la sécurité des patients et de l'importance de la formation dans les soins de santé. À mesure que ces propositions sont étudiées, elles doivent faire l'objet d'un examen par les médecins spécialistes concernés afin d'assurer des décisions guidées par l'expertise médicale, les données probantes et la sécurité des patients. While today's discussion is centered in eye care, the principles extend across the healthcare system. We recognize that decisions are made at the provincial level. However, the standards that guide them, training, accountability, and patient safety, are national. As ophthalmologists, physicians and surgeons trained in the full spectrum of medical and surgical eye care, we support the responsible modernization of care. We experience the same pressures: growing demand, access challenges, and the need to use healthcare resources wisely. But as solutions are considered, they must maintain alignment between training, scope, and patient safety. Ces principes, la formation, la responsabilité et la sécurité des patients, s'appliquent à l'ensemble du système de santé et sont essentiels pour assurer soins sécuritaires. Eye care provides a clear example of how these broader system challenges are playing out in practice, particularly in the context of proposals to expand for scope for optometry. This is a profession with which we work closely, and that collaboration is valuable and important in patient care. At the same time, there are significant concerns when proposals affecting medical and surgical care are developed and advanced by non-physicians without engagement of physician specialists extensively trained to provide that care. To understand why this matters for scope expansion, it's important to recognize what training in medicine involves. For physicians and surgeons, training is not simply about learning various tasks. It's about assessing patients through a multi-system lens, determining which investigations are clinically appropriate and why, and then interpreting those findings to make sound decisions in complex, time-sensitive situations. These skills and expertise are developed over years of training, completing medical school to earn an MD degree, followed by 5 years of residency to become a specialist, and often additional subspecialty training, all within a supervised, accountable system, national accreditation, and provincial governance as well. This structure is not incidental, it is essential to patient safety. Une formation médicale approfondie est essentielle pour évaluer les patients dans leur globalité, poser un diagnostic et prendre des décisions sécuritaires dans des situations parfois complexes et urgentes. Elle ne peut être remplacée par des formations plus limitées. Ophthalmologists are medical doctors and surgeons trained to diagnose and manage eye disease within the context of broader medical conditions. Other professions, including optometry, play important and complementary roles in care, but they are not interchangeable in terms of training, scope, or responsibility. The importance of appropriate training is seen in practice, where in eye care, consequences can include permanent vision loss. In one case, a patient was assessed for fluctuating vision by an optometrist who provided treatment for what was thought to be a localized eye condition. When the condition didn't resolve, a family member insisted that their loved one be assessed by an ophthalmologist who identified a life-threatening condition underlying the vision loss, a condition that required urgent, life-saving medical care. This highlights the depth of medical expertise required for diagnosis of systemic disease that can initially present as an eye condition. In another case, a patient was referred for a laser procedure recommended by an optometrist for a presumed diagnosis. When the patient was assessed by an ophthalmologist, the diagnosis was not what the optometrist had initially suspected. Proceeding with the laser treatment would have been unnecessary and could have resulted in irreversible harm to the patient's vision. The current proposal to expand scope for optometry include ordering diagnostic tests and performing procedures. However, it must be understood that these are not standalone acts and that short-form training is not a substitute for the comprehensive supervised medical and surgical training over years that underpins specialty care. Alignment between training and scope of care is essential to patient safety and to the responsible use of limited healthcare resources. L'alignement entre la formation et le champ de pratique est essentiel pour la sécurité des patients et pour une utilisation responsable des ressources en santé. Une formation plus courte ne peut pas remplacer la formation approfondie requise un médecin spécialisé. The College of Family Physicians of Canada has expressed support for this position taken by the Canadian Ophthalmological Society and for the importance of appropriate scopes of practice based firmly on the training and expertise of each health profession. Like ophthalmologists as experts in our field, family physicians carry a distinct skill set built on the most comprehensive training in primary care. They emphasize that while collaboration with fellow health professionals is essential, suggesting these roles can be replaced by non-physician healthcare providers oversimplifies patients' needs, demoralizes doctors, and undervalues physician training. Like the Canadian Ophthalmological Society, the College of Family Physicians of Canada supports collaboration, not substitution. Together, we urge policymakers to approach system change with a clear vision of an integrated, comprehensive healthcare system rather than addressing gaps through disconnected measures that contribute to fragmentation, delays in diagnosis, and increasing complexity in navigating care across multiple providers. Comme la Société canadienne d'ophtalmologie, le Collège des médecins de famille du Canada souhaitant la collaboration et non la substitution. Ensemble, nous encourageons une vision claire du système de santé intégré et cohérent pour éviter la fragmentation des soins et faciliter le parcours des patients. There are meaningful opportunities to meet challenges by building upon strengths within our system, but to ensure decisions are grounded in expertise, evidence, and patient safety. Any proposals for scope expansion must include formal review by appropriate physician specialists prior to approval. This is not about any one profession. It's about the systems we build and the standards we uphold in the best interest of patients. À mesure que le champ de pratique évolue, nous recommandons un examen par des médecins spécialistes avant toute approbation. Il s'agit des systèmes et des normes que nous devons maintenir dans l'intérêt du patient. Different roles in healthcare bring important contributions, but they are not interchangeable in terms of training or responsibility. At its core, the principle is simple. The level of care one is permitted to provide must match the level of training required. Patient safety depends on it. En fin de compte, le principe est simple. Le niveau de soins permis doit correspondre au niveau de formation requis. La sécurité des patients en dépend. Thank you. Merci.
Thank you. Merci. Nous n'avons pas de questions pour le moment. There are no questions at the moment. Would you like to add something to your statement?
Sure. Thank you for the opportunity to be here today. We appreciate the time. Eye care in Canada is at a pivotal point. And the Canadian Ophthalmological Society, we'd like to emphasize that we do support responsible modernization of care. At the same time, we also strongly believe that any expansion in scope in ophthalmology and anywhere in medicine really, it needs to incorporate the input of the specialists within that area of expertise at the outset, at the beginning of these discussions, so that we can be sure that as things progress, they're done so in a manner that, again, is based on expertise, evidence, and with patient safety at its core. We'd like to encourage the Health Ministers' meeting to include vision care on the agenda this upcoming fall, and we would greatly appreciate the opportunity and would look forward to contributing to those discussions. Thank you.
Thank you. This concludes the press conference. Merci. C'est ce qui conclut cette conférence de presse.
Thank you.